Intellijoint VIEW provides surgeons with a planning solution for total hip arthroplasty that incorporates the hip-spine relationship. 1 in 5 patients is in a high-risk cohort due to adverse spinopelvic mobility or imbalance. Over 50% of total hip arthroplasty revisions are avoidable. Of these, the number one reason for revision is suboptimal position of acetabular component. At-risk patients can be identified and planned for with a hip-spine analysis and preoperative templating. Incorporating the hip-spine relationship analysis on lateral X-rays can reduce the dislocation rate in patients by 6-fold. Introducing Intellijoint VIEW. Intellijoint VIEW is a web-based surgical planning solution that provides functional cup planning with the hip-spine relationship and implant templating to generate surgical targets for leg length inequality and offset restoration without requiring CT imaging. Intellijoint VIEW integrates seamlessly with your Intellijoint surgical navigation system. Intellijoint Hip, a surgeon-controlled navigation tool for total hip arthroplasty, is open platform, imageless, and compatible with any major implant vendor. Using Intellijoint Hip, you can deliver patient-specific plans from Intellijoint VIEW by navigating cup position, leg length and offset, and other intraoperative measurements. Intellijoint VIEW helps you discover which patients have adverse spinopelvic mobility, putting them in at-risk postures such as stuck standing or stuck sitting. Using VIEW, you can assess your patient's unique spinopelvic mobility, plan a functional cup position using the Target Zone Visualizer, identify leg length inequality, determine offset restoration needs, and choose optimal implant combination. Intellijoint VIEW leverages 3 X-ray images in functional positions: a standing AP, a standing lateral, and a seated lateral to evaluate your patient's pelvic orientation and spinopelvic mobility. No CT imaging is required. Intellijoint VIEW allows you to set pelvic tilt, standing sacral slope, and seated sacral slope to assess patient mobility. You can then select the Target Zone Visualizer to optimize component orientation. With the Target Zone Visualizer feature, you can plan a patient-specific cup position to accommodate mobility and help reduce the chance of impingement and dislocation. The templating workflow is a favorite among users, with its modern, easy-to-use interface. Intellijoint VIEW can measure leg length inequality, position the acetabular and femoral implants, and optimize your surgical plan. A QR code is generated to easily integrate with the Intellijoint Hip navigation system. Visit IntellijointSurgical.com and request a demo to see Intellijoint VIEW in action.